Welcome back to the Hourinvite podcast. My name is Nima,
My name is Aaron.
and today we're joined by Mr. Steven Sonenreich, the CEO and president of Mount Sinai, Miami. Thank you for joining us.
My pleasure. Good morning.
Well, first off, we just want to thank you for taking the time out to speak with us.
Pleasure.
We know there's a lot going on. And just for our viewers, can you just talk about your role here at Mount Sinai as CEO and president?
Well, the role of a president and CEO, I believe, in most organizations is to create a vision and to communicate that vision to all of our various constituencies and making sure that everybody is pulling in the same direction
Of course.
as we set goals and initiatives, and we're true to our mission. We're a mission-driven organization.
Okay.
And our mission is to provide high-quality care to our community, enhanced by teaching and research, because we believe that being a teaching and research hospital, it enhances the quality of patient care, and to be financially responsible so that as we execute on our vision and our mission, that we're spending dollars in a very responsible way and making sure that we are stewards of a very important organization in this community.
So before getting the role of CEO, did you ever plan on becoming CEO, or was this something that just kind of, one thing led to another and you're now CEO?
I'm not sure how many people really plan on becoming a CEO other than entrepreneurs who start up their own company and decide that they're going to be the CEO. I think that people in positions like my own start their careers from so many different starting points, and to what extent do they plan to be a CEO? I'm not so sure that many people have that level of vision and ambition.
Mm-hmm.
I did not. I was interested in a career in healthcare, and that career evolved as many careers evolve, not according to your plan, but according to opportunities that become available. And so my career headed in this direction, but I can't tell you that specifically.
You planned on it?
My plan was to be a hospital CEO.
Got it.
So you spoke earlier about offering quality care to every patient. How important is that in every day and what you do as well as CEO?
The number one responsibility that I have and that our leadership team has is the safety of our patients and the safety of the environment for our employees and for our visitors. It's all about having a safe environment. And a period like this COVID-19 period just further emphasizes the importance of safety in all of our lives, whether we're in healthcare or during our personal lives. And so quality, high quality, is always the most efficient and the most effective way of doing things. So when your goal is to have high quality healthcare or anything else that you may be doing, those that are the highest of quality are, generally speaking, the most efficient and the most effective. And so it starts off with recruiting high quality people and providing those people with the resources that they need in order to provide high quality health care.
When you started as a CEO, what were the main things you wanted to get accomplished, whether at the beginning or end of your career? What are some things that you want to accomplish and have accomplished?
So the most important thing for me when I started my career here as CEO was to create a vision, create discipline, create a commitment to a mission, and to be true to that mission. And many organizations have mission statements.
Mm-hmm.
Sometimes they're very long. One of the first things we did was take a look at our mission statement, and we contracted it to what it is today. We start all of our meetings with our mission statement, and we evaluate all of our decisions and our policies relative to that mission statement.
Mhm.
And so when we're contemplating new programs, our budget, um, and all of the different decisions that we make day in and day out, we say to ourselves, how does that tie back to our mission? And it's very helpful in making decisions and keeping everybody focused and keeping everyone disciplined.
So how do you maintain the balance between obviously providing excellent quality of care and obviously staying fiscally in a good state as well?
So I always believe that the highest quality is the most efficient.
Fair enough.
And so when you think about anything that you do in your professional or personal life, the great surgeons, if you will, are the most efficient in the operating room. And efficiency and quality and effectiveness really go hand in glove. The fiscal responsibility aspects of our mission are all about being disciplined and being focused and keeping everybody disciplined and focused in terms of the way they're doing their jobs. And it's walking that talk every day. And by doing that over time, you create culture. And so you asked me what was my first initiatives as CEO. It all develops over time, and I've been the CEO here now for nearly 19 years. And so over time, you create culture, and then you need to constantly tweak that culture, be true to that culture. But I think there's a very definite culture that exists here at Mount Sinai Medical Center, which is a commitment to high quality medical care and a commitment to the community and an overall family orientation. We live in a world of big everything, big box stores, big healthcare systems. And this is a large organization. We're the largest employer in Miami Beach. We're the only hospital in Miami Beach. We're one of the largest employers in Miami-Dade County. Yet we've been able to maintain a very family-oriented environment here. And that's a part of the culture that I know we all feel very proud of.
Like you said, you've been CEO for 19 years here. So after a while, some things might start getting repetitive. How do you keep that? How do you keep it fresh? How do you keep yourself motivated to, come in here every day and get the job done?
I don't think anything really gets repetitive. By the way, it's one of the great things about being a CEO and being a CEO of a hospital is when you think about it, you get to work with a ton of smart people. There are the doctors, all the allied healthcare professionals, the management team, our board, the people I interact with every day, really, really smart people. And so fundamentally, every day I have is different. And so although there may be some set meetings, we never know what today is going to bring because this is a 24-hour, 7-day-a-week operation. We never close the doors. And so when you look at this year's environment and you think about COVID and preparing for COVID and ramping down the organization in anticipation of COVID surge, ramping up the organization now that things have been in decline, trying to stand the hospital back up. And then you're also preparing for hurricane season starting on June the 1st. And there are so many different things going on right now that are constantly changing how we readapt the organization because the organization today is much different than it was back in early March
Yeah.
before all this happened.
Yeah.
And so when you think about the change that we all are facing in our lives, again, personally and professionally, and you think about an organization of this size and magnitude with all the different activities, literally hundreds of thousands of procedures and activities going on every day, 13 different locations. The complexity of all of this provides an environment where we're never bored here.
Yeah. You brought up COVID-19. How has that affected anything at the hospital? Has it changed anything where things are, going to stay permanent the way they changed, or is it just a temporary thing for now as far as how things have changed in the hospital setting?
I think the COVID-19 experience has changed a lot of things that we all do and the way we handle ourselves, and is evolving. So I'm not sure we know the answer to that. Like so many other difficult challenges, we learn from those, and we try to learn what we did right and what we did well, and try to repeat that, and we try to correct the errors that we may have made and learn from that as well. So this is all evolving, and I don't think we're going to be able to really look back on this experience and be able to say what were the key items that we learned, probably for another 6 to 9 months or even longer.
In terms of innovation and expansion, what do you have planned here for Mount Sinai in the foreseeable future?
So expansion for us is much about continuing to bring our quality healthcare to our community through our satellite facilities.
Okay.
We feel that the most important relationship for a patient is a relationship that they have with a primary care physician. And so we feel that the more satellite locations that we have with high quality Mount Sinai physicians, where patients are able to establish that relationship, is the most important thing that we do for the community. And even more important, given that there's a shortage of primary care physicians. And so by doing more and more satellite facilities, we're able to provide access, and that's the key to high quality healthcare.
Throughout your career, if you look back, what are 3 life lessons you've learned that you take with you to this day?
Well, I think that when I look back over my career, which now has been a long time, it goes by pretty quickly, by the way, is that there's no replacement for hard work and trusting your instincts and being hands-on and being visible and trying to constantly challenge yourself and challenge those around you to be better. And so it sounds very trite, but those things that we learned at home as kids or at school or in houses of worship, those very basics of working hard and doing the right thing, and that to me has been the keys to my own success. And it's what I try to share with people who ask me that question all the time. And many people visit with me who are in graduate school or in college, undergraduate school, and they want to be a hospital administrator or a hospital CEO, and they ask the same kind of questions that you're asking, which is, so how did you get here? And I think that you have to be willing to try to outwork everybody around you, and be lucky. There's there's no replacement, for good luck. But I've always felt that when you work hard, you make your own good fortune.
That working hard perspective, do you think there's a certain trait that an administrative CEO has that is commonly shared with everyone all across the board of CEOs?
I think just like every other profession, everybody approaches their position differently and has a different attitude based upon where they came from and what their upbringing is. And so I'm not sure I could think of one consistent trait that I've seen amongst many CEOs that I've had the good fortune of interacting with over the years, not only in healthcare, but in other fields. I think that the trait that's consistent among those that are successful is an ability to surround yourself with people who are stronger, smarter than you are, people who culturally share the same values of hard work and strong character, and people who have a vision that they're able to communicate and lead with.
How important is work-life balance, and how do you integrate that into your career?
So, balance between work and lifestyle is something that's very popular these days, and many people talk about trying to strike a balance between work and their personal lives. And I think that that's a very personal decision based upon what your ambition is. And so for me, I think a lot of people would say that I don't have a good work lifestyle balance because of the hours that I spend working. But I feel that I do. It's what works for me, and for other people, they need more time for themselves, and if that cooks for them, that's great. I think that it's a very personal decision.
Okay.
In an interview in 2014 with 91.3 FM, you had announced that your health system would start publishing its charges, commercial insurers for procedures. What made you want to make that decision?
So the reason why I wanted to publish all of our data is because I believe that transparency is something that is very important with our community, and in particular for not-for-profit institutions. And because I believe that the cost of anything goes up when transparency is not there. I feel that we owe it to the public to be transparent about pricing, given the fact that we have so many millions of people who are without health insurance and so many people who are challenged with the expense of healthcare.
So in your role and throughout your career, have you ever had moments of insecurity, inadequacy, thinking I'm not good enough, can I do this? And how do you deal with that? Because I feel like a lot of people moving into new roles, they feel they have those moments when they may not feel like they're good enough to do that role. So how do you deal with that, and have you had that situation?
I think everybody has a little bit of insecurity. If they tell you that they don't, I don't think they're being honest. The question is really more about having a strong enough ego to surround yourself with people who are really strong and really smart. And when you do that, that certainly is a sign of security. And so when you're in a position of leadership, you have to feel secure enough that you can surround yourself with people who are very strong and who will challenge you and want to be challenged. And you're not always going to agree, but you have to be willing to have that challenge because an organization, is about putting together a team of wonderful people, great people, exceptional performers, people who are on the same page, and the ones that win, just like in sports, are the ones who have the strongest team.
You've mentioned a couple times about surrounding yourself with the right people. So we're in school, we always hear mentor-mentee situations. Who are some key players in your throughout your career that have inspired you and make you push harder?
So I have a very strong board of directors, and who are all very successful people and wonderful people because they're also very generous with the hospital, and they embrace the mission of the hospital, and they feel strongly, very strongly, about what we do for this community. And by having a strong board and a series of board chairs and committee chairs, because when you're a CEO, you should be spending, and I do, a significant amount of time with board members and board leadership. And because those people have been successful in many different businesses, and because hospitals are essentially many, many businesses within one business, I'm able to draw upon their expertise in order to help with our strategy and our decision-making process, and I do that very often.
So during this pandemic, everybody, of course, has had to adjust and has been working hard. If you could send a message to all of your employees, what would you say to them?
Well, we've been sending messages to all of our employees consistently throughout this challenge, and that's through email, that's by our actions, that's by making rounds, which I do all the time, and having visibility and being here, because I've always believed that during a critical period, the captain needs to be with the ship, whether that's a hurricane, whether that's a situation of this nature. And that consistent message is that we respect you, we respect what you do, we respect the fact that you're putting your life at stake in many cases, and we're here to do everything we can to support you, whether that's with PPE or making sure that the environment is as safe as possible for us to do our jobs in. And so it's not just email and snail mail and memos, but it's also being out there and walking the talk, and people seeing that leadership is there and that they respect them and that they believe in them. And that's the most important aspect of people knowing how much we respect what they do. And that's whether they're people who are in the clinical areas or people who are keeping the hospital clean and safe. And I always tell people at new employee orientation that everybody's role is important, everybody. And as CEO, if I'm not around for a week, a month, you probably won't miss me. But if the people who keep the hospital clean aren't around for a day, you're going to miss them. And so everybody's role is important, and I firmly believe in that.
What are some things you're curious about right now?
Excuse me?
What are some things that you're curious about right now?
I'm most curious about the analysis that will be done post-pandemic, hopefully sooner than later, and really understanding how this virus gets transmitted in the community and what we could learn from it, so that the next situation like this, we'll be much better prepared.
If you could, if you could go back in your career and relive certain moments or do something differently, what would you do differently, if anything?
Yeah, I don't go backwards.
Okay, well, good
I
answer.
only have a forward gear. I don't have a reverse gear.
All right.
I could tell you the top 5 to 10 decisions that I made that I may have changed if I had a do-over.
Okay.
So I'm very well aware of those, and I think about it and I try to learn from it. But I believe in learning from your mistakes and moving forward and not dwelling on them.
Okay.
What is a common myth that's attached to being a CEO
A common myth
Mhm.
about being a CEO
at a health system?
of a health system.
Mhm.
Gosh, that's a tough one.
Maybe it's things you hear from people and you're like, oh, it's really not like that.
I can't think of anything common about CEO mythology or what have you. Just like generalizing about anything and or any role. I think that when I look at jobs of any kind, there's an old expression which is, does the position make the person, or does the person make the position? And I think we all approach our jobs differently. And maybe when you're a CEO, you have a little bit more of a blank canvas to define your role with. But I think we all approach it differently. I don't think there's any right or wrong. I think that the proof at the end of the day is, during your tenure, did you move the organization forward so that your successor can take it to the next level? And I would view my own success years later in terms of, was my successor able to take it even further? And if that person is more successful, then I will look back at my tenure as CEO as being more successful than if that person was not able to do better.
Yeah, I was about to follow up with that question, saying like, when you're done retiring as a CEO or whatever, what would you like to be known for?
A lot of people talk about legacy, and I think that I tell people that I believe that your legacy is about your family
Mhm.
and your children, and not necessarily about where you worked. I think what I am known for and will be hopefully remembered, for is that that I worked hard and I really cared.
What do you think is the hardest decision you've had to make throughout the course of your career?
The most difficult decision that you make is when you reduce the workforce, when you lay off people, and or you terminate people.
Yeah.
And that's the most difficult decision. And I always tell our team that always should be the most difficult decision when we part company with somebody.
You talked about terminating people, firing people. The other end now, when hiring someone, what is one thing in 2020, in our generation, that you would want to see a character trait or something they bring to the table that you would want to see people that work for you have? And do you think that whatever that is missing nowadays in the youth?
I think that whether it's 2020 or 2030 or 2010, the most important thing that we look for with people is character, strong character and competency. So someone could be extraordinarily competent,
Yeah.
but if they're not people of character, then this is not the right place for them.
Mhm.
And so Character and competency are really the two most important guidelines for us.
If you were sitting in our shoes and you had to ask yourself a question, what would you ask?
um,
Or do you have a question for us that you would like to ask? You go either way.
sure. I'd rather ask you questions.
That works. That's
I'll
totally
answer
fine.
all the
Let's turn the
questions.
tables,
That's totally
guys.
fine.
Time for you guys to do a little work. So what motivates you to enter into healthcare?
Well, it started with my dad. He's a respiratory therapist at Kindred Hospital, and I've been around healthcare my whole life. Also, I had a really strong bond with sports. I played basketball, and I like being around a team atmosphere. And so I felt that I could bring that aspect to the healthcare realm using what I learned. And so the reason myself and Nima started this whole project is because we felt like there was a void missing in the healthcare world between the layman and the healthcare professional. And so working as a team is something that's paramount with both of us. And we felt that we could bridge that gap by doing what we're doing now. So that's really what got me started into healthcare.
Great. And
Yeah.
yourself?
Well, I actually didn't know what I wanted to do in undergrad. I come from a family of physicians that come, so I never wanted to. I knew I didn't want to be a doctor. So, but long story short, I volunteered at a hospital down here in the pharmacy, and I just fell in love with it from there on,
Right.
and I wanted to be part of it. And the reason why we started this, like he said, was to really try to make it some sort of impact, like in pharmacy, where a lot of people are seeing us as introverts or not really out there, and we want to kind of break that gap and really make that connection between bring everyone together in all different healthcare professionals, dentists, optometrists, physicians, pharmacists, and try to really put pharmacists on the map that like we can do this and we can be compared with the other healthcare professionals.
Great.
So I have a question for you now.
Go ahead.
So you said Mount Sinai is the only hospital in Miami Beach. Obviously, there's other hospitals within a couple 10, 20, 30, 40 miles away. How do you deal with competition? Do you see it as a competition? Do you learn from them? Like if another health system was to do something innovative, do you see it as competition? Do you see it as, oh, let's work together to, provide the best care? How do you see it?
So I always like to say that there's always going to be competition.
Mm-hmm.
And if you focus too much on the competition, yes, you should know what your competition is doing and try to understand it. But there's always going to be competition, no matter where you are in history. And so we just have to outwork the competition, and just try to do a better job. It's just that simple. And it gets back to when we open up all the satellite facilities,
Mm-hmm.
what we're saying is people value Mount Sinai. They value the brand Mount Sinai. They identify it as being synonymous with high quality, and they want to have a patient-physician relationship. And to the extent that we're able to bring people into that patient-physician relationship, that means that we're going to be successful for a very long time. That Nova Southeastern, I guess it's Nova. It's just Nova now.
No, it's Nova Southeastern.
It's still Nova Southeastern.
Yeah.
So Nova Southeastern started, as an osteopathic
Mm-hmm.
hospital and medical school,
Yeah.
going back to Dr. Terry, who passed many years ago, and who I knew, going back to the late 70s. And when you think about the origins of the institution where you're receiving your training, the origins were all about primary care medicine.
Yeah.
And we feel that with all the technology that keeps advancing, that the most important aspect in healthcare is that primary care relationship, just as Dr. Terry sought out with. And look at the way Nova has grown.
Yep.
And when you think about the pharmacy school and the dental school and all the other allied health schools that are at Nova, you see this direct interaction between the patient and the professionals. And so, yes, there's going to be a lot of competition, but the closer we can get to the patient, we'll continue to do well, just as Nova is.
So I have two fun questions to end this all with. If you had to be shipwrecked on a deserted island, but all your human needs such as food and water were taken care of, what two items would you want to have with you?
Well, can I have family with me?
No, it has to be items.
It has to be items.
Yeah.
My iPad.
See, I knew you were going to do that. That's why I said items.
My iPad.
Your iPad? And one more?
And one more?
Yeah. Two items. There's no internet connection, by the way, in case you want to change your mind about the iPad.
Say that.
There's no internet connection on the island, in case you want to change your mind about the iPad.
That's useless. So forget about
and you can't charge it, so once the charge runs out.
Forget about the iPad? Oh, that's an interesting one. That's an interesting question. And I remember reading it and thinking about it. So you're deserted. There's no internet connection.
No Wi-Fi, no outlets.
No Wi-Fi, no outlets.
A lot of sand and water.
A lot of sand and water. Can I get like a power boat of some kind?
Yeah.
Yeah, that's an item.
That's an item. There you go. All right. So an iPad and a power boat. That's perfect. That sounds like Miami Beach. And then lastly, if we were to go back to your high school undergrad days, and we were to speak to your friends, and we were like, who was Mr. Sonenreich? What would they say?
If they asked about me?
No. If we were to go ask them who you were, what would they say about you? Your friends, colleagues, your teachers.
Sure. Well, that's a good question too. Well, that's a good one.
What do you hope they would say?
So, I'm proud to say that I'm still in contact with friends.
We can give them a call and ask them
from college and from high school.
That's good.
And matter of fact, we had a Zoom call the other day, 8 of us, and from college.
Okay.
And so I think that they would tell you that I always studied hard, worked hard, played hard, awesome. And they're not surprised that I've had a lot of success.
That's awesome.
And so the class of 2020 didn't get to have a graduation. You're the CEO of a health system. What message do you have if you were given the opportunity to talk to all the class of 2020? What message would you have for them?
Well, I think they did. They did or are going to have a graduation, and so I think graduation is not about the ceremony. And by the way, I didn't go to my undergraduate graduation because I went right to work, and so I think that education is all about the educational experience and not necessarily about the graduation. Arguably, the class of 2020, which will probably be known for the pandemic, have learned more from this experience about life that they will take forward with them professionally and personally. And they'll find that they were really blessed to have that experience. And they'll have plenty of time to party.
You mentioned COVID-19 have a blessed experience. What is one positive thing that you have taken out of the pandemic?
Just reinforces that healthcare workers are now more than ever respected as part of the safety net, along with police and fire.
Mhm.
And I always would tell different audiences that during 9/11, which is the closest thing
Mhm.
to COVID-19 in terms of a national tragedy, that while everybody was going home on 9/11 to be with their family and loved ones, because nobody knew what was going on and where this was going, and
Mhm.
country was at war, that healthcare workers went to the hospital and to be with their patients. And so I think that the reinforcement of the importance of healthcare workers is, for me, the most important silver lining in this challenge.
So, to close it off, what's the last message you want to send out to whoever's watching this, the audience?
The most important thing is, to me, is people, taking good care of themselves, and again, it sounds trite, but being healthy and having a healthy lifestyle, and that's physically, that's mentally, eating right, all of those different things, are so important in terms of your own happiness and your family's happiness and the quality of the life that you lead.
Perfect. Well, we want to thank you for taking the time.
My
Sit down with
pleasure.
us. I
It's
know
good
we're
being with you guys.
we're in
Thank you.
middle of a pandemic. It's slowing down, so we appreciate you sitting down with us.
My
Thank you so
pleasure.
much.
And good luck to you all.
Thank you.
And
And,
good luck to you, Phil.
and thank you to everyone that was tuned in. My name is Nima,
My name is Aaron.
and thank you for accepting our invite.